what are clinicians expecting to happen? What is their expectation of the healthcare industry over the next couple of years?
Well, that's an interesting question. I don't know if we have enough time to really get into any great detail with this, but the thing is that doctors' expectations have been very low with health information technology, to be quite honest with you. Again, I've been a user for many years and been through the travails, and I've helped to orient and educate physicians about what is available out there in health information technology. We are at a crossroads now. We're going through a transition that really has been facilitated by a number of things. Partly the technology now is there that allows us to be able to do things. The connectivity, the ability to collaborate with our colleagues and all that. So the internet really plays a huge part in this. And we're all becoming very skilled at using the internet to be able to do that. So that's part of it there. So, and again, the other technology is the knowledge management, the clinical decision support tools, the evidence-based medicine, all these sort of things. Communicating that to the physicians, though, that have been for the last 15 years being told that they had to go and get an EMR, spend a huge amount of bucks to implement something that's going to make their life more difficult and oftentimes make them see fewer patients and all that sort of thing. They've had very, very low expectation. We're getting to that point now of making it where it's easier to adopt, that it can become more of a modular and an incremental adoption as opposed to the big bang that has become the norm in health information technology. And as a result of that, we have the opportunity to become familiar with a particular area and then expand on it as we go.
Sure.
But what's really important as we go through this is keeping after it. Because we talk about adoption, but typically when people talk about adoption, they're talking about, we've rolled it out and they've got an ID and okay, good luck. The problem is that this is an extremely difficult area to incorporate into the normal workflows of a doctor's office. The process redesign is very difficult and has to be mapped out ahead of time and thought through very carefully. So by doing this in more of a modular and incremental fashion, this allows docs to be able to do the things that they need to do to achieve the goals that they have from a business standpoint. Now, if they want to participate in various incentive plans, they can start with e-prescribe and do the different e-prescribing incentives such as the MIPA incentive plan. But then maybe they want to go to patient-centered medical home, so maybe they bring the tools in to be able to do that, and then ultimately meeting the meaningful use criteria for ARRA. There are a lot of different opportunities out there. Some docs are going to do very well with traditional EMR, others are going to have to come along very slowly, and then there are many people in the middle. So at this point in time, the expectations I think are very high that this industry has to meet, and for once I think we're actually starting to meet those.